Hello, dear friends. I am Dr. Shankar Khobragade, MBBS, MD Medicine, practicing as a physician and diabetologist and cardiologist in Nagpur. And today, I feel very fortunate that I should give some information to all my friends and viewers that how to prevent heart attack. Because nowadays it is found that most of the patients are in tension and they get sudden heart disease, sudden heart attack. The incidence of sudden cardiac death, even in the developed countries like America, it is up to 5 lakhs of the people they die of the, even though they are asymptomatic. They don't have any symptoms, but still they can get heart attack. So what is heart? The heart is a very important muscular organ of our body, and its function of the heart is to supply oxygenated blood to the entire body. Heart pumps are up to 60 to 80 times per minute for the entire life to supply oxygenated blood to the body, and it therefore needs large amount of oxygen and nutrients to work properly. And there are two coronary arteries. One is called as left coronary artery and another is called as right coronary artery. So this most vulnerable artery is left coronary artery because the plaques or the obstruction is inside the left coronary artery, and main left coronary artery is responsible for this. As far as the heart disease is concerned, it is found that around 25% of the deaths in India are because of the heart related diseases, and it is definitely a thing to be considered, and we have to be very alert because heart attack occurs 10 years earlier in India as compared to other Western population. And if the patient is more than 60 or 65 or 70 years of age, then the incidence is very high, and around 50% of the patient they can die because of this heart attack. It is found that heart attack and stroke are the predominant causes and responsible for around more than 80% of the heart diseases related to deaths in India. So now you'll ask me, what is heart attack? Like all other parts of the body, the heart also requires a good supply of oxygen to perform well. Oxygen is a life. Oxygen is required for everything for the cell to survive. And if the oxygen is not there, then the heart cell, all the muscles, called as this muscle and the cells inside that, cardiomyocytes, they will be deprived of the blood supply, and the heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. Why this happens? Because coronary arteries, they supply the heart muscles. When the blood flow can become narrowed from buildup of the fat, cholesterol, other substances like triglyceride, low density lipoprotein, and there is an obstruction or the plaque inside that, and then you will definitely get some sort of complication because of this. So this is a very slow process. Most of the patients, they argue that they don't have any disease, but I say that they say that we are very healthy, but we say that if the man is healthy, if his endothelium is healthy, endothelium is inside of the arteries, and these muscles are also there. They are called as that muscles, and this, it is a slow process. It starts atherosclerosis. It starts from at the age of 2 years, and then the complete process become narrowed, and that atherosclerosis and the heart attack occurs at the age of 40 years. I have seen the patients in whom the heart attack occurs at the age of 18 years, and that he was a very lean, slim person and working in the field, labor worker. He had sudden severe chest pain, severe sweating, vomiting, and he was brought by his colleague, and after taking the ECG, it was found that a severe heart attack, and we have to give him this DC shock, which is called as defibrillation, because this patient was getting repeated attacks of this ventricular fibrillation, that is irregular beating of the heart. So don't think that it is a one-day process. Anything it requires, there is a cause and effect. For every effect, there should have been a cause. So you will ask me now, what are the risk factors of the heart attack? If the patient's age is more than 65 years of age, by and large, he is in that age group. If his family members like his father or mother or uncle or a grandfather, If they suffer from heart disease, he is more likely to have 2 times more prone for heart disease. If he is having blood pressure, if he is having diabetes, the diabetic patients are very vulnerable for this heart attack, and it is found that it is 2 times more common than the non-diabetic patients. If the patient is smoker, if patient is having obesity, if he is having metabolic syndrome, or he has a sedentary work, or most important is if he is having a very lot of tension in the life. Suppose he has taken lot of loan and he is not able to repay, and there is no source of income, definitely he will be in the tension. Especially it is found that the software engineers or the doctors or the surgeons who are doing surgeries on their patient, they are in tension. And it is, if you take driver and conductor, the incidence of heart attack is more common in the drivers as compared to the conductors. If you take the physician and the surgeon, the incidence of heart attack is more common in the surgeon, and like cardiac surgeon or neurosurgeon or this. So your job or your profession is also responsible for your heart attack. And most important is race, your habit, eating habits, and lack of exercise. These are the very important causes of this. Now, you cannot change your parents, because you cannot change you cannot have a choice to have a birth in which country or in which situation you will take the birth. It is the nature. So nature is supreme, and that naturalism is very, very important, and nature decides everything about you. So there are modifiable risk factors and non-modifiable risk factors. Modifiable risk factor means you can modify it is inside. You can change your the destiny. Suppose your cholesterol is very high, you are taking lot of fatty meal, non-vegetarian food, lot of cheese, butter, or the food which contains saturated fat. Then your cholesterol will be increased. High blood glucose, sugar, that is very, very important. And it is found that in India, most of the patients are having, they can have this sort of diabetes. And it is found that India is becoming now second capital after the China. And in some areas like Goa or other affluent states of the India, the incidence of heart disease is very, very high. And diabetes is very common there because of they are eating a lot of cashew nuts, beer, alcohol, smokers, not doing regular exercise. Affluent people get most common. So heart disease is a disease of the affluent society, affluent people, and it is found that high blood pressure. So there are 2-3 types of blood pressure. One is primary blood pressure, secondary blood pressure, in which, and other is white coat hypertension. What happens in white coat hypertension? If the patient comes to hospital, his blood pressure, suppose at home it is 120/80 diastolic, but suppose he's coming to hospital, it is increased by 20 millimeter of systolic and diastolic. So it will be found that his blood pressure is about 140 to 100. And another is mass hypertension. In mass hypertension, it is opposite to white coat hypertension. His blood pressure is normal in the hospital and it is abnormal at home. So, such patients who are dippers, non-dippers, smokers, alcoholic, poor diet, high calorie consumption. So, these are the now most important question is asked by the patient that can heart attack prevention is possible? Is it reversible? Yes. Diabetes is also reversible. Lifestyle modification is very, very important. And yes, prevention of heart attack is possible. For that, we need to control risk factors of heart attack like high cholesterol, high blood pressure, diabetes, smoking habits. Excessive anger is also responsible for heart attack. It is found that the patients having sudden sorrow, sudden anger, their heart there is a balloon inside the heart. It is called as Takotsubo's cardiomyopathy. What is Takotsubo? Takotsubo is like a balloon. Immediately after the excessive anger or excessive sorrow or a suffering, the normal healthy person can get this sudden heart attack, or there is a rupture of the interventricular septum, and if you see that the patient was talking in front of you and now he is dead within 2-3 minutes. Most of the patients, they are brought in the night thinking that they are having acidity, and I tell to my patient that don't get confused for heart attack and acidity. If it is acidity, always think it can be heart attack. So any abnormal time, if patient is getting severe chest discomfort or epigastric pain or feeling of vomiting, nausea, loose motion, sweating, any abnormal feeling in the chest or constricting pain, you always think that it can be a heart attack. So you go to the nearest cardiologist or a physician, get your ECG done, get your troponin T test, and rule out the possibility of heart attack. Because high blood pressure is a silent killer, heart attack is a silent killer, and the person who is a earning member of the family, he is like an engine of the family, and his heart is like an engine in his body. So it is our duty to keep the engine properly working, because heart is the only organ which works for from birth to death entirely. It does not take any 1 minute rest or 2 minute rest. Brain is very intelligent. Brain takes at least 8 hours sleep, and heart is working throughout. So how to revert this heart attack into normal? Healthy lifestyle changes like regular exercise, healthy diet, equally important for the heart attack prevention, and regular checkup is very, very important. Most of the patients, they are brought in casualty or in emergency department to our doctors, and most of the even qualified doctors are also, they are neglecting their symptoms, and they think that it could be because of tension or acidity or high blood pressure. So important advice is that you take your ECG always, know your blood pressure, know your cholesterol, know your sugar, know your hemoglobin A1C. I call it A, B, C, D. A for hemoglobin A1C, B for blood pressure, C for cholesterol, and D for your dyslipidemia or the triglyceride level. So, how high blood cholesterol causes heart attack? What is cholesterol? Most of the patients, they ask, what is this cholesterol? Cholesterol is a waxy, fatty substance in the blood, and some cholesterol is produced by the body, mostly in the liver, and remaining comes from the food such as the red meat, cheese, butter, and yellow of the eggs. So cholesterol is used by our body to build up and maintain the healthy cells. The cell cover is made up of our cholesterol. But high levels of cholesterol can increase the risk of heart disease. And cholesterol, mind well, is only tip of the iceberg. It is only tip of the iceberg. But there are other hidden 280 risk factors inside the blood, inside the arteries, inside the endothelium. So, like LDL cholesterol or lipoprotein A or HDL cholesterol, which is a friendly cholesterol, and most important in Indian or diabetes, it is called as triglycerides. So the cholesterol does not mix well with the water, so cannot float freely in the blood, and that's why needs to be packaged into the certain proteins. Cholesterol is combined with the proteins, and they are these proteins and fat. Cholesterol, it is called as lipoproteins. And there are two types of major lipoproteins. One is high density lipoprotein called as friendly cholesterol and good cholesterol. Another is low density lipoprotein, often called as bad cholesterol, just like you have good friends and a bad friend. So HDL is like a good friend and LDL is like a bad friend. So how high blood pressure cholesterol causes heart attack is a question. So when levels of LDL becomes too high, and in that there are small dense LDL particles, and they are called as atherogenics, then this excess LDL cholesterol likely to accumulate within the vessel. Just like your pipeline, the water is coming from the pipeline, and if there is some sort of damage, and then other things like calcium or other radicals, they accumulate inside that, and the arteries, they get blocked. More and more such accumulation in the coronary arteries, they lead to the blockage of the coronary artery. So if you are healthy, your coronary artery is healthy. Previously, we used to say that if your man is, if he is healthy, his blood pressure and sugar is normal, is healthy. But nowadays, if endothelium and coronary arteries are healthy, then he is really healthy. So what cholesterol does? It partly blocks blood flow in the heart vessel, like left coronary arteries. And till that time, till the complete blockage is there, the right coronary arteries is doing the job, and it provides the blood to the myocardium or the heart muscle. But if it ruptures, then, and if that ruptured plaque is obstructing the coronary artery, then the remaining blood supply and the remaining blood which is carrying the oxygen and glucose to the myocardium, it is hampered, and you can get sudden necrosis or the death of the contracting myocardium muscles, and that's why within 1 hour, that is we call doctors as a golden hour. If you are lucky, if you are residing in the area where your cardiologist friend is there and you can reach within 5 or 10 minutes to his cath lab and he is working, and then immediately you can be taken into the cath lab and he can do that PTCA, primary angioplasty, and that clot can be removed immediately and your blockage can be. But everybody is not lucky. Most of the patients, they are staying at home. There is a traffic. He cannot reach to the hospital. At least like a city, like a metro city like Mumbai or Delhi, patient cannot reach to the hospital. So most of the deaths are occurring within 1 hour, and that's why we tell to the patient that prevention is better than cure. So always take care that what is your ECG, what is your treadmill test, what are your troponin T test and all that. So an entirely blocked artery supplying the blood to the heart leads to the heart attacks. So now we'll discuss how to manage and control high cholesterol. Cholesterol is not an enemy. It is not a complete enemy, because cholesterol is needed because our brain is made up of these lipids or a cholesterol, and too much reduction of the cholesterol also is high. So you have to keep your minimum level or optimum level of cholesterol, optimum level of triglyceride, optimum level of hemoglobin A1C. To control high cholesterol, we need to adopt healthy lifestyle in our everyday routine life. So heart healthy diet is important. Most important is eat more vegetable, fruits, whole grains, legumes and nuts. Limit the salt, sugar, food, fatty food, junk fast food, fried food, processed food, etc. So the things which are prepared without oil. I always tell to my patient there are 3 enemies in life. One is called as, I call them SOS. S for salt, O for oil, and S for sugar. Just like in our brain, there are 3 enemies: and excessive anger, excessive attachment to anything, and our ignorance. So ignorance about the heart, ignorance about your body, ignorance about your investigation, and if you take a faulty diet, your diet is very, very important. If you take very rich diet, you will get a rich diseases like heart attack or diabetes. If you take a poor man's diet, you will get a very small common cold or poor man diseases. So regular exercise should be integral part of your routine. But there are some patients, they argue with the doctors. Docs, I am walking morning, I am taking morning walk, I am doing regular exercise, I am healthy, and I don't require any investigation. Nothing has happened to me till the age of 50 or 60 or up to retirement. And suddenly, one day they are brought with the chest pain, heart attack and all that. So don't take it granted that your heart is healthy from inside. So unless and until we do your angiogram, unless and until we do your 2D echo, unless and until we do your treadmill test or ECG, nothing, you don't declare yourself as I am a fit person. So let your cardiologist, let your physician decide that your heart is healthy from inside as well as outside. So regular exercise is also important, but it is found that if patients are having arrhythmias or some sort of short PR interval syndrome like LGL syndrome, WPW syndrome, Brugada syndrome, in which there are arrhythmias, and you might have read the news in the newspaper that some marathon runners, while running, they have collapsed and died. And there are some cases, patients taking regular cardiac check, cardio in the gym, and it is found that suddenly they have collapsed and died. Why this happens? Because this happens due to their arrhythmias inside the heart. Coronaries are normal, but there are some short circuits inside the heart, and these short circuits, they become active and patient gets ventricular tachycardia or irregular ventricular contractions of the heart or ventricular fibrillation, and these patients are very vulnerable for death. Some sportsmen, they die suddenly during playing the cricket. There are some conditions, even if you have some blow on the chest, cardiocomitis, this is called as, suddenly the heart stops. So there are so many heart diseases like rheumatic heart disease, ischemic heart diseases, or coronary heart diseases. So what are the tips for the healthy heart life? Saturated fat should be account for less than 10% of the total energy intake. Replace with the unsaturated fat. Replace your oil with the oil with that ratio you have to maintain, omega 3 versus omega 6 fatty acids. Creams, cheese, butter, other wholemeal dairy products, fatty meats, they all contain these saturated fats, and this should be avoided. And you have to take some fish or some sunflower seeds, all that. So things which we consume by chewing, they are good, and the things which consume by deglutition or just swallowing, just like a soft things, that are not good. So because your saliva is also one of the medicine, and it has got so many enzymes, and it prevents the heart attack. So keep trans fat as low as possible. Try to avoid artificial trans fat in the processed food, and this can be found in the fast food. So don't love the things which are very white. Which are the things which are very white, like cheese or butter or sugar or salt or maida? So these things are bad for our heart. Keep the natural trans fat to less than 1% of the total energy intake. About the salt, most of the patients, they have a habit of sprinkling the salt on on their food, and don't increase your salt intake more than 5 grams per day. Or if you are taking sodium chloride, it should not be more than 2,300 grams per day, milligrams per day. So 30 to 40 grams of the fiber per day. Fibers are very important, so always use onions, tomatoes, sorts of salads, preferably from the whole grain products. At least 200 grams of fruit per day, 2 to 3 servings. When I went to one visit in the Stockholm, I asked to my guide, what is the incidence of heart disease in the female in your country? She said the incidence of heart disease in our Stockholm is very less. I asked why. They said that they are consuming olive oil, and it is customary that the students going into the school, it is the duty of the teacher to give one fruit compulsory to each and every student. So these teachers, they are working like their mother. So at least 200 grams of vegetable per day. Fish is very important for heart, and it is found that in Japan the people are consuming a lot of fish, shrimps and prawns, and it contains the proteins, so that's why they are good, and it contains the things which are not increasing your saturated fat levels. There are some antioxidants, and the grape seeds or resveratrol, it should be consumed properly. There are some other super antioxidants like astaxanthin, they should also be consumed. So 30 grams unsalted nuts per day, or like pista, can be eaten, or some sort of these nuts. Most of the important things are Bengal gram should be taken regularly. Sugar sweetened soft drinks and alcoholic beverages should be avoided. Then, how to deal with the high cholesterol? A lifestyle changes usually reduce LDL cholesterol level by about 10 to 15%. But there are some patients, they say that after taking statin, they complain that they are having muscle pain, muscle ache, myopathy, or abdomyolysis. The incidence, if they don't tolerate such statin, high doses, we reduce the dose or we change the statin. And along with that, we give some aspirin tablet or coenzyme Q10 or super antioxidant like astaxanthin. So control your cholesterol, control your lipoproteins B. It is found that in Japan, the lipoprotein A is high, and India, lipoprotein B is very high. So lipoprotein B is for bad and A is for good. So always check your lipoprotein. Your cholesterol is normal, then the patient argues that, doc, my cholesterol is normal. How I have got heart attack? Then I say that even if cholesterol is normal, what is your lipoprotein B level? Then lipoprotein B is more vulnerable, and it is genetics. So we advise medication to them. We advise to control their blood sugar. Keep your hemoglobin A1C level between 6.5 to 7. Blood pressure between 120 by 80 diastolic. Do not stop medication. Most of the Indian patients, what they do, if I advise 500 milligrams of the sugar, or suppose we advise 500 milligram of tablet twice a day, they reduce the dose and make it half, like 250 milligram. Or suppose we advise 1000 milligram of the dose, they on their own, they stop some medicine they reduce the dose, and suddenly stopping any molecules like metoprolol and all that, that should not be there. So, how diabetes increases the risk of heart attack? Patients with diabetes often have unhealthy cholesterol levels, including this control of blood pressure, sugar is very important and very important to prevent to heart attack. So lifestyle modification and medication and this medicine prescribed by the doctor are very important, and physician always I call the person lucky if he gets a good wife and a good physician or a good doctor, because doctor's knowledge is very important, and you have to be selective, choose your doctors properly, ask so many questions to them that why this is happening to me, what is my heart risk of heart attack. So American Diabetic Association, it has given some guidelines. American Cardiac Society, they have also given some guidelines. So usually the patients are at what time we should check at what age we should check your cholesterol. I say every year, starting from the age 20 and to 40. Every year you should check your blood pressure, blood sugar, cholesterol, lipids and all that. And most dangerous thing is smoking. It is found that there are so many professions in which it is now common that cigarette smoking is a fashion, and even the ladies are also are involved in the smoking. So it is not good habit to smoke, to take alcohol, and the patients who are taking more than 4 packs of alcohol or a whiskey, they are very vulnerable for this heart disease. And usually we advise to take them only wine, and that is also which contain resveratrol. Do not start or stop, change medication or dose medication on your own or as per advice of the chemist, friends, relatives, or based on the social media changes. So how high blood pressure increases the risk of heart attack? Because this heart attack now it is beating. So resting heart rate, if it is more than 100, the chances of getting heart attack are more. So we are advising nowadays, keep your heart rate between 72 to 80 per minute. Then that cholesterol will also be normal. So patient with the previous heart attack, it is called as secondary. The patients at the age of 60 years got heart attack, blockage, he has done angioplasty, and still he is getting some sort of pain. Then again redo angioplasty or bypass surgery, and which medication should be taken to them. Usually we advise statin tablet, rosuvastatin, clopidogrel, and it is not that he is suffering from only one disease. He can have hypothyroid disease, he can have other diseases, so like Parkinsonism or so. The things, very important thing is that control your blood pressure, and to prevent the heart attack, it is very important. I will conclude by saying that to control the high cholesterol, high blood sugar, high blood pressure, you have to select your diet. The diet which is green, which is colorful diet, all the things which are colorful like green cabbage or green vegetables or the red tomatoes. So all these things should be eaten properly with the proper care, and fiber should be included. Take 45 minutes of exercise daily, eat healthy hard food or fruits, and do some meditation, because relax yourself and consult your doctor if you are having any doubt. So as far as this, now since last 3 months there is this COVID pandemic, COVID-19, and most of the patients, they are inside the home, they are not able to do exercise properly, and because of high fatty diet, it is found that the incidence of atherosclerosis will increase and they will come with this. So what are the various vulnerable population, usually age more than, it is found that during this corona epidemic, COVID-19, around more than 56% of the patients who died, who succumbed to this illness, they are either having heart diseases already or hypertension or diabetes. The patients having bronchial asthma or COPD, they are not, it was found that they are dying because of pneumonia, but it is found that they are dying because of this DIC or some sort of thrombosis or some sort of myocarditis or the clots. So blood pressure, diabetes, high cholesterol patients are found nowadays, and it is kind request to all my brothers and sisters that they should take their care properly. Don't neglect your symptoms. Don't take advice of your neighbors. don't take advice of some quacks or unqualified person or the faith healers. We call them faith healers because of lack of knowledge or overconfidence, and don't take anybody's medicine. Every medicine is specific for each and every patient. There are some patients, there was one patient, he was suffering from rheumatic heart disease or heart failure, and his neighbor, he has suffered from heart attack, and this patient was taking a tablet of digoxin. Digoxin is just for increasing the heart contraction, but in heart attack you have to decrease your heart contraction. So he has given 2 tablets of digoxin, and because of that, that heart patient has aggravated his symptoms and he dies. The most common symptom we call is angina. So any pain related to chest or your pocket or neck pain. There are some patients, they are coming with the tooth pain, they are coming with the shoulder pain, they are coming with the neck pain. So these abnormal symptoms at abnormal time, they should be thought that it can be a heart attack and it can be a catastrophe. So once heart attack occurs and within 1 hour, if anybody does not get any treatment like angioplasty, so it is the best time to check your treadmill test, ECG, angiography, and at least invest in your angiogram. Angiogram requires only 8 to 10,000 of rupees, and nowadays there are non-invasive tests like nuclear scan or this coronary scan, coronary calcium score. So this test should be done properly, routinely. Don't love your money, love your heart. Most of the patients think that doctors are charging too much, doctors are becoming rich, they are so don't think like this, because doctors is a qualified person, and he will and always have one doctor friend with you. In emergency, contact your physician, contact your doctor, and always write his phone number near your telephone directory or near telephone or on the wall. So that what happen, anybody, there are 1 or 2 patients, they died because of lack of knowledge about the heart attack, and they thought it is a just sort of acidity they have neglected, and time has gone, and now most of the patients, they are brought dead, and at that time there is a lot of hurry, and they request us that please start his heart, do anything, start oxygen, give him DC shock. But when patient is brought as a dead body to our hospital, then it is a very pathy situation, and doctor cannot do anything at that time. So it is my advice to the patients or my friends or the person who are very much interested in the health, that your heart is the engine of your body and your brain is a controller or a higher center or a driver of your body. Don't listen to your driver. Driver demands so many things. He wants smoking, he wants drinking, he wants meat, he wants a lot of fatty foods. But control, and always control your desire. The main cause of our suffering is desire, and that desire should be controlled by proper control of your mind. Mind is everything. That's why these diseases are now, and I would like to conclude by saying that man is known healthy if his heart is healthy, and if coronaries are healthy, then don't fear that when you're going to the hospital, doctor will charge you more. They are also human beings. There are some family members in their family, and they will not give wrong advice. It is most of the patients, they think, they listen to other practitioners of alternative medicine or other doctors, and they get confused. And when doctors advise ECG, they argue that no, I don't need ECG. And after next day, then he gets heart attack. There are so many cases in my life that even though people were rich, but because of their argumentative nature, arrogant nature, they could not take proper medication, and now they have died. So it is a very pathetic situation. So dear friends, ladies and gentlemen, it is my humble request to you that keep your heart healthy, control your blood pressure, control your cholesterol, take less food, at least eat. My advice to my patient is rule of 50. Follow rule of 50. Whatever is served to you, always only 50%, and remaining 50%, keep it for the next meal or keep it for the next generation. Use it properly. Don't waste food. Food is very, very important. Drink proper water. So always that this body is like a machine. So don't get, and always we do servicing of our car when we get a call from the service garage that your car requires service after 6 months. So as a doctor, it is my request that you should give yourself call, or your spouse should be very intelligent. It is the duty of the spouse or the duty of the wife to bring the patient to the hospital, because she is the most sufferer. When her husband dies, then there is a problem. Children, there is a problem. Education and everything, his income is lost. So just invest 10,000 rupees, one for angiogram, one for TMT, ECG or cholesterol, and at least 10,000 rupees can save your life and you will be very healthy. So I pray for your healthy and very fruitful and wealthy life. Thank you so much. I am Dr. Shankar Khobragade, taking your leave now. Thank you for listening to me. I am very much obliged. Thank you so much. Good day. Goodbye.